Hi, my beauties. So I just have a few minutes in my clinic where I'm in between patients, and I figured, well, I might as well just make a YouTube video. So the reason why I want to do a video on this topic is because this is probably one of my most common asked questions by my patients. A lot of people come in to talk about the under eye area. So this area right here under the eyes. Now, whether it is fine lines, wrinkles, volume loss, dark circles, regardless of a patient's age, whether he or she's in her 20s, 30s, 40s, 50s, 60s, or beyond, it's always something with the under eye area, right? And there's different treatments that we can do to target each one of those different changes that we see under the eye, whether it's loose, crepey, thin skin that's starting to form fine lines and wrinkles, whether it's separation of the fat pads or a little bit of volume loss, which is creating tear troughs that can make the eyes appear like sunken or hollowed out, or make you appear tired, or if it's dark circles that are either genetically dark because of the skin type and texture or pigmentation, or if it's dark circles because the skin is thinning and you're seeing that underlying vasculature underneath the skin, which can kind of give like a blue, purple, greenish discoloration to the under eye area, which can also make us look tired, gaunt, sickly, or just like exhausted or older. So there's lots of different treatments for under the eyes, and I figured I've posted this before in my YouTube video, but because I had some time and because it's a very commonly asked question that I get, I wanted to do a video on this today. So the under eye area, I think especially because we're walking around with our masks like this, and it's the most drawn attention area in the face that like our eyes will go to, because usually between the masks and the eyes, this is kind of the area that gets exposed, and most people have been focusing on this area for quite some time. Also because, like I said, women and men of all ages will have some type of change under the eye that bothers them. And so, when it comes to different tightening devices or lasers that resurface the skin to stimulate collagen and elastin, that helps with minimizing the appearance of fine lines and wrinkles. Now, if you're older and you already have fine lines and wrinkles, there are treatments that we can do with either Fraxel laser or Thermage, which is a tightening device, or Fraxel, where we combine both treatments, which just knocks it out of the park with beautiful, amazing results. Kind of like a 1 + 1 = 3 result is what I always tell my patients. That's more of like for the fine lines and wrinkles. And the reason why we get fine lines and wrinkles under our eyes and lax skin under the eye area is because that skin is so thin, it's the first to show our age. So as we lose collagen and elastin, which are proteins in the extracellular matrix in the dermis of the skin, it gives skin that structural support. As we lose that over time, that skin starts to get thinner and crepey and wrinkled and lax, and that can even start in our 20s. So when you're more proactive, for my younger beauties and myself, I'm in my 40s now, but I did this when I was in my 20s. I was always resurfacing under my eyes to help keep that collagen and elastin stores up so that I can keep that under eye area nice and smooth and tight. So Fraxel laser and Thermage, and both of them together, both stimulate collagen. So the opposite is true. A loss of collagen in that area causes fine lines, wrinkles, and lax skin. So when you stimulate collagen, the opposite is true. And you can take a more preventative approach by doing these treatments early on, maybe every few years in your 20s or 30s, to kind of prevent fine lines and wrinkles from happening at an earlier age. Once those wrinkles and fine lines and lax skin already has happened, sometimes you need more treatments, usually like 3 or 4 treatments based 1 month apart, to erase those fine lines and wrinkles or make them appear less apparent or less visible or less noticeable. So that's where Fraxel and Thermage or Thermofrax come into play for fine lines, wrinkles, laxity, and they work by stimulating collagen, which helps smooth and tighten the skin. Now let's move to dark circles. Dark circles can be from excess melanin in the skin, which is the pigment in our skin. Now this could be a genetic predisposition. So just like skin that bunches, like say on the back of your elbow, when you straighten your arm, your elbow gets darker. When you bend your arm, it stretches out the skin and it's not as dark. Sometimes that under eye area can show kind of discoloration from excess melanin in the skin. Now lasers like a YAG laser or a clear and brilliant laser, or even a Fraxel laser, can help minimize the appearance of that pigmentation in people who are genetically kind of predisposed to having dark circles under the eye because of that excess melanin. However, dark circles under the eye can also happen from the skin kind of thinning out and showing the vasculature underneath that infraorbital or under eye area that can kind of have a more like bluish, purple, greenish look. Now that's different than excess melanin or pigmentation under the eye from, excess pigmentation in the skin. The bluish, greenish, purplish discoloration is usually erased by a laser called V-beam. V just stands for vascular, and it's a 595 nanometer wavelength laser. And usually you need anywhere from 1 to 3 treatments spaced about 1 month apart to kind of erase that under eye dark circle appearance. And the downtime's not too bad. There's usually no bruising. Usually there's a little bit of swelling, but it's not very noticeable, and it kind of in fact looks like tear trough filler, so people usually like that downtime. And it's a little bit of mild redness that you can easily hide with some tinted sunscreen or concealer. So V-beam is for dark circles from the underlying vasculature or thin skin. Hyperpigmentation correction with a laser like a YAG laser or a Pico laser or a Clear and Brilliant can help in genetically darker skin that can kind of have that dark circle appearance under the skin. And also for fine lines and wrinkles, we could do Thermage, or Fraxel laser. And the last thing that I wanted to address for the under eye area is volume loss. So as we gain wisdom and get older and age, our fat pads underneath the skin can separate and thin out, and it can cause a little area called the tear trough underneath the eye where the two fat pads kind of separate. Using tear trough filler, usually Vobella is the filler that I use, and I always use a cannula. If your injector doesn't use a cannula, ask him or her why. It does require a little extra training to learn how to use a cannula, but the safety effect profile is definitely worth it. There's less bruising, there's less swelling, there's less risk of intravascular occlusion and complications that can happen from tear trough filler, and only trust an expert injector with this injection because it's very advanced. But tear trough filler in this area can help restore that volume loss. So instead of it being like hill, valley, hill with a little indentation here, it just fills in that kind of gap where there's some volume loss. So adding a little bit of volume, and the key is to just be very conservative. If you're a patient of mine, you know I'm a very conservative injector. Less is more. Successive approximations to your goal is always a better result. Most of my patients are 10 to 15 years younger than they look, and they look like nothing has been done, and that's the goal. So basically half a syringe on either side is usually how I inject the tear troughs, and you just basically just fill in that little depressed area where there's some volume loss so that you have a smooth eyelid cheek junction. A smooth eyelid cheek junction just gives a more youthful look, it gives a more refreshed and revitalized look, and it just makes you look younger and fresher and brighter. So sometimes the tear trough area, if there's a little hollowing there, it could be anatomical. So I even have my patients who are younger who have a little tear trough, and it's not that they're aging or having volume loss, but they anatomically just have a hypoplastic under eye area, and doing a little filler will just help brighten them up. Usually the results last about 2 to 3 years, so it's a longer result that lasts a longer period of time than like filler in the lips or in other areas of the face. And then for my more mature patients who have actual volume loss from their fat pads separating, or volume atrophy, fat atrophy, and that under eye area, sometimes even using some lash regrowth serums have been shown to decrease the adipose or fat tissue right here. So if people have it for whatever the reason, doing a little bit of filler in that area can be very refreshed and revitalized look to it. So those are kind of the different changes that happen from under the eye, but I just kind of wanted to delineate the different treatments and the different targeted therapies that we use to address different changes that happen under the eye, whether it's volume loss, dark circles, fine lines and wrinkles, and whatnot. And sometimes it's a combination of both. Sometimes people will have dark circles and volume loss and, under eye wrinkles, and we'll have to kind of take it at successive approximations to a goal. First, we do some Fraxel or Thermage to tighten up the skin. Then to kind of like lighten up the dark circles, we'll do a little V-beam. Then if they still have volume loss or the contour irregularity is still present, then we do a little bit of filler. But it's always best to be conservative and to just kind of know what you're treating and what the mechanism of action is for each of those treatments so that you get the best outcomes. And just go to an expert injector or an expert laser surgeon who knows what they're doing, knows exactly what lasers to use and which settings to use, because you can also make things worse if you fall into the wrong hands. Okay, so that's my under eye lecture for today. I love you guys, and it's good to be back on YouTube. I missed you.